Because even when we go to presentations with YouthSpeak, asking for help is the thing that kids struggle with the most. They don't know where to go. They don't know who's going to listen. They don't know if they have a listening ear at all, right? So having this to just decipher what your options are just makes it so helpful.
When you involve young people in creating resources for them, you end up with something that truly resonates and can better meet their needs.
Another episode of the Speak Real podcast, sharing one-on-one conversations. We believe that storytelling is the best way to empower youth and give them the platform to find their voices.
Presented by YouthSpeak. Youth experience, youth voice, youth empowered.
Hello, everyone, and welcome to our podcast for today. My name is Ashley, and I'm a youth speaker and facilitator here at YouthSpeak. And today I have a very, very special guest who I already love so much. Her name is also Ashley, and we're going to be talking about the participating in my mental health care toolkit. So, Ashley, can you please share a bit about yourself and your professional background, including your involvement in the Participating in My Mental Health Care Toolkit project?
Hi, so nice to meet you, Ashley, and thanks for the warm welcome. As you mentioned, my name is Ashley Radomski. I use she, her pronouns, and I'm a cisgendered female and European settler. I am very grateful to live, work, and play on the traditional and unceded territory of the Algonquin people, which is also known as Ottawa. And yes, I am a senior researcher at both the Knowledge Institute on Child and Youth Mental Health and Addictions, and I also work as a researcher at the CHEO Research Institute. And as you mentioned, that's the Children's Hospital of Eastern Ontario. Now, both organizations are focused on generating and sharing evidence-based information that improves the mental health of children, youth, and young people in the province. My journey in mental health research has been quite the adventure. Over 12 years of digging into both numbers and stories to really understand mental health and substance use challenges. I've had the chance to work across 3 different provinces in Canada, which has given me a dynamic perspective on how healthcare systems work. I moved to Ottawa for a postdoctoral fellowship, which is essentially more research training. And I've been working with the Knowledge Institute and CHEO for more than 5 years now. And what really drives me in my research are values like genuine collaboration, reciprocity, and the power of lived expertise in storytelling. And it's these values that were the spark that led to the Participating in My Mental Health Care Toolkit project. And as one of the lead researchers, my role is to be the bridge connecting all the amazing people involved in this project. I facilitate collaborations between our youth and caregiver partners, research participants, and other experts and collaborators, making sure everyone's unique knowledge and experiences are incorporated. I do bring some research know-how to the table, making sure we stick to important processes like ethics and timelines and budgets, and also ensure that how we collect and analyze data meets the standard for best research practices. However, I like to think that my main mission is to really champion and support the ideas of young people and caregivers every step of the way. To me, they're the real experts on mental health and substance use issues that affect them. And my role is to help turn their insights into action and also into tools that can be used to help others too.
That is incredible. Thank you so much for that absolutely beautiful introduction. I looked at the toolkit myself and I was in awe from start to finish. I was like, everything in here is so what's the word I'm looking for? So intentional. Everything has a purpose and it feels like the youth are being supported at every step of the way. There was nowhere where I was looking like, okay, there's a gap here. Something could be filled here. Like everything was so beautifully put together. And I feel like it's going to be such an incredible benefit. Okay, I'm going to have you talk a little bit more about the toolkit. So what are the main components of the toolkit and which needs does it address for the youth?
Well, first off, Ashley, I'm so happy to hear about your positive experience that you had with the toolkit. So thanks for sharing. That really lights me up. So the Participating in My Mental Health Care Toolkit is like a friendly guidebook for young people and their families navigating the sometimes confusing world of mental health and substance use services in Ontario and across Canada. We heard from young people and caregivers as part of this research project, but also many others, that it can be very difficult to know when, where, and how to seek help. So this toolkit includes a variety of information, reflective activities, and 4 fillable PDF worksheets that young people can use to personalize their own mental health care help-seeking journeys. So the first worksheet can help young people figure out what kind of supports they're looking for. They can record and categorize their challenges into the need for, say, informational support, such as instances where someone considers their overall well-being to be pretty good, but could use some tips for managing stress, building healthier relationships, or just learning about mental health topics in general. Or someone might have a need for coping support, such as when there has been a more noticeable change in their mood, self-care, or daily life behaviors, and maybe they aren't quite feeling like they used to. They might like someone to talk to or ways to develop skills for sort of managing their challenges. Then there might be a need for more urgent support, such as when a young person is in an immediate crisis, their situation is unsafe, or they often feel completely taxed or overwhelmed from one day to the next. Then we have a second worksheet that helps young people identify current or potential contacts that can make up their support network. We provide an overview of the various types of mental health and substance use services available to young people, along with some specific examples in Ontario and across Canada that might match the challenges that they recorded in the first worksheet. So services and supports might be things like walk-in clinics, helplines, counselors, smartphone apps, loved ones, working with various other healthcare professionals, and even accessing specialized services that might need a doctor's referral. Then we have a third worksheet, and this helps young people explore different services and see if they're a good fit. We've included a list of questions inspired for young people that they can use themselves to consider, such as whether they have all the basic service information, such as the location, wait times, and cost. Do they know what services are provided? How they're provided, such as online, in person, both, and what is involved in the service? Do they want to know or have the details about the professional who will be providing the service, such as their background, lived experience, language, or training? And does the young person have a sense of whether the service might be convenient, private, or meet what they're looking for right now? And then the fourth and final worksheet in the toolkit helps young people pull everything together and start to develop a simple action plan for when, where, or how they might like to seek support. Plus, it encourages young people to recognize and celebrate the ways they are already caring for their mental health and the coping strategies they can build on. What's great is this toolkit is available in an English and French.
Nice.
And there's a version for caregivers, parents, or adult allies to use as well. So the toolkit is all about empowering young people along their mental health care journey.
That is awesome. Everything you said, I'm like, when I was looking through it, I was like, all of those boxes are ticked. Everything that you just explained are exactly what I got from the toolkit. I even like went through it and I made like notes on like what I loved about each section. So I wanted to share that with you because I was just so happy to read it. So the first thing that I absolutely loved was distinguishing the different forms of support that you guys are exploring, giving them the options to explore, knowing that support does not look like one thing. Having the coping support, the urgent support, and the informational support. Like you guys are really hitting those levels to make it accessible to everyone. And then I was looking at the creating a support network visual. First of all, I love having visuals, and I thought that page was just so beautiful to look at because everything was just so interconnected. And again, it emphasizes that support doesn't look like one thing. If one form of support maybe doesn't work for you, that's okay. You can either leave it or maybe you can come back at a later date when can be a little more fruitful for you, right? But that's okay because you have all of these other ones at your disposal. So I just loved having that emphasis on that, and anything that involves the youth having a big hand and are being at the forefront of their mental health and their mental health journey. I feel like it's so important, which is something that I really, really love about you guys. And the other thing that I love so much was being able to break down the support networks that you guys provide. You're basically like assessing it. And I feel like that can make it seem a lot less scary for the youth when, yes, you have all these supports available at your disposal, but you might not know which one is really right for you based on your individual needs. And I feel like just going through that and being like, okay, these few supports are ticking my boxes. I feel very comfortable and I feel seen based on the information that I've seen with them. And I think that's great. That's why I love this toolkit. I feel like it has that comfort and it makes you feel more okay and more at ease when it comes to reaching out for yourself and just knowing that you're okay, because there's so many different ways to get support and so many people and organizations willing to help you and help you help yourself as well, which is awesome. Okay, enough of my rambling about how lovely you guys are. Next
Well,
question.
thanks for sharing the look and the feel about the toolkit and your impressions of it, because I think the young people and caregivers that were involved in co-designing it would just be jumping up and down hearing it right now, because I think that was absolutely their intention and their hope for folks like you and others out there to get when they open that toolkit and start playing around in it, is to feel a little less alone, a little more confident, and a little more inspired or hopeful about all the different options of support out there.
Just reading through it, like I felt that support. What inspired the creation of this toolkit?
Well, the real inspiration behind the toolkit came from young people themselves. So we used an approach called participatory action research, PAR for short, which is all about putting young people in the driver's seat of the research process. So we started with a group of young people and caregiver partners who were keen to get involved in research that could make a real difference. And they were part of every phase of the project from start to finish. This project had two main objectives. The first one was to better understand the needs, preferences, and experiences of young people and caregivers when it came to mental health and substance use services in Ontario, especially since the pandemic shook things up, and to use that understanding to create a resource to help young people and families become more aware of existing services and the ways that they might access them. So we held virtual focus groups with about 40 young people and several caregivers from across Ontario to hear directly from them. And their experiences and ideas became the foundation for this toolkit. Then we had those partners use the key messages from the focus groups, as well as their own ideas, creativity, lived expertise, to design a resource that would address those common concerns. Partners wanted a resource to be informative, empowering, and actionable. And with those principles in mind, a toolkit began to take shape.
And another thing I will add is that it's very easy to follow, which I think is so important. Like everything, the tips are tangible, they're usable, and they're easy to understand, which I think is so important. We know this project was a collaborative effort that included insights from youth, among others. Could you walk us through how it was developed?
This project was all about teamwork and putting young people's voices front and center. So after the virtual focus groups, the young people and caregiver partners dove into what we call design lab sessions. And they were run by two fantastic young adult staff members from Mind Your Mind, a mental health and engagement program that works with youth to co-create tools and promote wellness. So we had 7 design lab sessions, each about 2 hours long, held roughly once a month. And these sessions were also virtual using Zoom, so that partners from all over Ontario could join in. And as part of our meaningful discussions and innovation, we use all sorts of cool online tools like Google Jamboard, Forms, Canva, email to capture and implement everyone's ideas. And these sessions involved moving through a process of brainstorming and prototyping, co-creating, reviewing, updating, and then eventually finalizing the toolkit. So the young people and caregiver partners were at the heart of these sessions, with the Mind Your Mind facilitators guiding the process. I was lucky enough to be a fly on the wall as this all happened. And all I can say is it was a creative, iterative process where everyone's input was really valued and incorporated as much as possible. Behind the scenes, we also had a team of researchers supporting the process. So Dr. Mario Capelli and I are the principal researchers on the project, but we had several other researchers that are also based at the CHEO Research Institute and the Knowledge Institute on Child and Youth Mental Health and Addictions, and team members from other academic centers and organizations in Ontario and Quebec that joined in as well. So the project was funded by the Canadian Institutes of Health Research, which allowed us to bring all these great minds together to create something truly useful for young people.
And you sure did. I actually did an IG live with Mind Your Mind with Jill and Valentina, and we talked so much about having youth at the forefront of their mental health journey, because even when we go to presentations with YouthSpeak, asking for help is the thing that kids struggle with the most. They don't know where to go. They don't know who's going to listen. They don't know if they have a listening ear at all, right? So having this to just decipher what your options are just makes it so helpful.
When you involve young people in creating resources for them, you end up with something that truly resonates and can better meet their needs. Involving youth every step of the way, we ensured the toolkit is designed to fit their specific needs, uses language or images or colors or a format that resonates with them and addresses issues that really matter in their lives. So our job as researchers is to make sure the blueprint can actually be built in the real world and follows all the important good rules of research. And the great thing about co-design resources is they tend to have greater relevance, use, and positive impact among those they were designed for, which is amazing. And to me, co-design sends a powerful message to young people. It says, your voices and experience matter. The change you want matters, and you can be a part of that change.
Absolutely. Everyone has a seat at the table, and I feel like that's such important messaging, making sure everyone is feeling included and everyone is understood. What message do you have for youth, parents, or professionals considering using your toolkit?
I love this question. First and foremost, I'd really like young people to remember that they're not alone on this journey. This toolkit is here to connect them with the support they need and to remind them that there are people and resources out there that are ready to help. So for young people, this toolkit is your ally. It's designed to help you understand your needs, explore your options, and, take charge of your mental health journey. It can give you a sense of what your next step is along the way. And even if you're not sure where to start, that's okay. That's exactly what this toolkit is for. And for parents and caregivers, I would say this can be a great way to start conversations about mental health or substance use with the young people in your life. It can help you understand their perspective and find ways to support them, because there's even a version specifically designed for you. And professionals, consider this toolkit as a way to connect and build trust with the young people you work with. It can create a shared language and understanding about mental health needs and services. And ultimately, just keeping in mind that this toolkit is a way to increase hope and a sense of empowerment. It's about taking the first step, no matter how small, towards better mental health.
Even if you feel like your mental health is in a great spot, you may not even think there's anything you need help with, but just like going through that every once in a while as like a checklist, just like to check in with yourself, see how you're really feeling. Because I know for me, sometimes if I'm not in the best headspace, I don't even notice. I don't even notice because it's not something I'm thinking about, just going through the motions, but I think I'm fine until things pile up and it gets too much and it's overbearing. And then I notice like, how did I even get here? But if I had like a toolkit like this that I was looking to every couple of weeks, even every week, and just checking in with myself, seeing who I am today and what I feel today versus what I felt last week. I feel like that's so beneficial in building that relationship with yourself and also upholding relationships with other people, bringing your best foot forward so you can connect with others on such a personal front. So yeah, this is great.
That's beautiful. Yeah, you're right. Learning about and caring for our mental health is both an inner and an outer journey, Ashley. And I think the way you described it really summarizes really well that we need to think about both ways that we can take care of ourselves. Yeah.
Sure. Where can our audience find participating in my mental health care so they can use it or share it with others?
I'm so glad you asked. The toolkit is super easy to access and it's completely free. So you can download the toolkit from two places. One is visit the Mind Your Mind website and look for the Design Lab section. You'll find the toolkit there. The second place is you can head over to the Knowledge Institute on Child and Youth Mental Health and Addictions website. We have a resource hub and you'll spot the toolkit there. Now, the best part is you can use it as many times as you'd like, and it's totally anonymous. So Ashley, if you do want to use it on a weekly or more regular basis, no problem. No personal information is collected when you use the toolkit. So it's there for whenever you need it. So feel free to share it with friends, family, or anyone else who might be helpful. Those who live in Ontario, other places in Canada, it's meant to be used. And we do really want this resource to reach as many people as possible. So if you have other ideas or ways to do that, feel free to connect with me or any other of the team members to share your ideas. Or we'd love to hear your own story or how you use the toolkit. It's really these stories that keep us doing the work that we do.
That's so great. I will be using this toolkit. I pinky promise you, because I just think it's so amazing. Yes. And yeah, just keeping up with myself, especially because I'm a student, also have jobs and responsibilities and things to do. So yeah, just checking in with your mental health is such an important aspect of growth and life in general.
I'll also let you know that I myself download and use the toolkit in my regular and daily life, because I also know that doing the work I do and being a person in this world, that taking care of my own mental health is a priority for me too. So I really appreciate you inviting me here today to talk about the toolkit, the work I love, and it was really nice to get to know you a little bit better.
You as well. This was so awesome. Make sure you use this toolkit. It's such an amazing, incredible tool. I really went through it in detail. I took notes and I had only positive things to say because it is so thorough. It is so intentional and it's articulated beautifully, honestly.
And in the meantime, be well.
If you want to hear more stories, don't forget to subscribe, comment, and like. To support more youth by youth-led projects, visit us at youthspeak.ca, where you can donate and spread youth mental health awareness.
YouthSpeak Charity. Speak, inspire, change.